Aaron Beck developed a cognitive theory of depression when he found what he called cognitive distortions in the thoughts or cognitions of his patients. Cognitive distortions are thoughts that can cause individuals to perceive reality inaccurately. These are the thoughts that can convince someone of something that isn't true. For example, I am a failure and soon everyone will see that. Everybody hates me and is out to get me. I have the worst luck in the entire world. It is all my fault that he is mad and I can never do anything right to please him. She's late, it's raining, she is hydroplaned and her car is upside down in a ditch. If people really knew me, they wouldn't like me. These types of cognitive distortions reinforce negative thinking, negative self-talk, and serve to keep us feeling bad about ourselves, others, and the world around us. If you have ever tried to reason with someone with distorted thinking, or ever tried to quiet the critical voices in your own head, then you know how challenging it is to change those ideas once they have set in. Why is this? What role do thoughts have anyway? In cognitive behavioral therapy, or CBT, therapists believe that our thoughts influence how we feel, our feelings influence how we behave, and our behaviors reinforce our thoughts. The more frequently this loop plays, the more ingrained the thoughts or cognitions become. Challenging and changing cognitive distortions is a key element of CBT. For Beck, negative thoughts reflect underlying dysfunctional beliefs and assumptions. Situational events trigger these dysfunctional beliefs, and unhelpful emotional patterns of behavior emerge. Cognitive behavioral theorists believe that clients can take an active role in changing and modifying their dysfunctional thinking. CBT group leaders tend to utilize concrete, short-term interventions, so they must be skilled at drawing on a great variety of brief interventions aimed at efficiently and effectively solving problems and aiding members in acquiring new skills. Modeling these adaptive skills and helping members identify and strengthen weaker skill areas are main components of the leader's role. As mentioned earlier, CBT therapists believe clients can play an active role in changing and modifying their cognitive distortions and dysfunctional patterns of behavior. Therefore, leaders teach their group members that they are responsible for becoming actively involved in their treatment, both in the group and outside of it. Skills are taught and practiced within the group, and then each member has homework to do between sessions that reinforces what they have learned that week. Working with the client to develop their assignments proves to be the most beneficial to their treatment. By working in this way, leaders emphasize a plan for change and help their members understand that insight and verbalization alone are not sufficient to produce change. A unique aspect of CBT with groups is the specific goals of change. More than any other therapeutic modality, the CBT approach to group therapy focuses most concretely on very specific target goals. When planning treatments and interventions, the CBT group leader makes SMART goals for the group as a whole and clients individually. A SMART goal is specific, measurable, achievable, relevant, and time-sensitive. Cognitive behavioral therapy is one of the most influential and empirically validated approaches to psychotherapy. CBT groups are well designed for people who struggle with mood problems, anxiety, depression, grief, substance use disorders, confidence, self-esteem, and relationship difficulties. Individuals with social skills deficits and ADHD are also well treated in the CBT group setting. Studies show that individuals with dissociative identity disorder do not respond well to group treatments like CBT alone because they do not traditionally focus on trauma, and these clients need help resolving the traumatic causes of their illness. Clinicians developed trauma-focused CBT to meet the growing needs of those clients affected by trauma. Additionally, research shows that individuals diagnosed with borderline personality disorder are most often best served through group dialectical behavior therapy, or DBT, not CBT. Beck writes that the therapist acknowledges and empathizes with how the patient feels, and nowhere is that more needed than in groups for individuals dealing with grief and loss. Each year, there are over 40 million unpaid Americans, about 1 in 8 people, in the role of caregiver to an elderly loved one. Of those caregivers, 71% experience pre-death grief, which is often associated with psychological distress, depressive symptoms, and reduced physical health. The CBT leader will want to use interventions that facilitate the caregiver's acceptance of loss and change through the various stages of their caregiving relationship. Distorted cognitions prevent members from recognizing, experiencing, and accepting painful emotions. In caregiver support groups, members often say, "I shouldn't feel sad, at least my loved one is still alive." That thought leads to feeling shame. Now we know that feelings lead to behaviors, and this causes members to ignore the painful emotion and instead beat themselves up for the shame. Beating oneself up for feeling ashamed reinforces the thought that they shouldn't feel sad. Members will continue suffering as long as they stay distracted from feeling their painful emotions. An alternative thought to the negative one is, "Things are not the same as they once were, and I miss that." This thought leads to feeling the painful emotion, and allowing oneself to feel the painful emotion leads to acceptance. Acceptance reinforces the thought that things are not the same, and they miss it. Another automatic negative thought preventing members from dealing with painful emotions is, "I have to be stronger for everyone else." Now that thought leads to feeling weak, and that leads to them ignoring the painful emotion and instead beating themselves up for feeling weak. Beating themselves up reinforces the thought that they should be stronger. An alternative thought that they could replace it with is, "I feel responsible for everyone else, and at the same time, I am hurting right now." That thought leads to feeling the painful emotion. Feelings lead to behaviors, and this feeling leads to acceptance. Mindfulness practices are varied, and this is a short self-compassion exercise that can be done when a member is particularly distressed. It begins by identifying and naming the uncomfortable emotion. For this example, let's say the painful emotion is grief. Have the members place the palm of their hands over their hearts and close their eyes if they are comfortable doing so. As a group, they would ideally repeat this after another member leads. This is a moment of grief. Grief is a part of life. In this moment of grief, may I be kind to myself. May I accept myself just as I am. May I give myself what I need. May I care for myself just as I need. And this can be repeated several times. In addition to grief support groups, CBT has proven to be useful for helping groups of individuals with substance use disorders and process addictions. The techniques and interventions of CBT aim to do more than just stop unwanted behaviors. They encourage members to discover the reasons driving their behavior, and then, through understanding and acceptance, members can employ new skills for future success. Let's consider a group for smoking cessation. One member working on moderation management has gone from smoking a pack of cigarettes a day to now just 4 or 5. They have been able to go weeks at a time without smoking, and they are feeling discouraged because they have started again. They are beating themselves up and feeling like a failure. A successful intervention would be the one we did in the grief group intervention of changing the member's cognitive distortion of, "I can't quit smoking and I'm a failure," to a healthier alternative thought, "I have drastically cut down my smoking. I want to smoke less and I am doing my best." The leader might use another intervention to help the member identify triggers for their behavior, and this can be approached in many ways. For this example, the member will examine the positive consequences they experience because of smoking. because people do things they know are bad for themselves because they are getting some good things from it. It is those good things or benefits that keep drawing a person back to that behavior. In CBT addictions focused groups, members create healthier alternative options for experiencing the same positive consequences. Describe a time when you usually smoke. In the morning before work. Describe the triggers usually associated with smoking in the morning before work. Feeling tired, feeling hungry, needing to clear my foggy mind so I can focus on work, and it really has become a morning habit or ritual as well. Next, the member can describe the positive consequences associated with smoking in the morning. Because nicotine is a stimulant, it often acts by making you feel more alert and suppressing your appetite. Feeling more alert will naturally help them focus better on the job. By having this every day as a habit, they are actually creating a 12 or so minute quiet space before they start their day. Everything is calm for a bit, they are ready for the next thing, and they have given themselves time to prepare for it mentally. Doesn't that sound pretty awesome? Who wouldn't want that every morning before work? Now the next step is to come up with healthier alternative options to smoking before work that will give them similar benefits. Some options they may come up with are 15 minutes before work, eat a light breakfast with their morning coffee, or perhaps do a self-compassion meditation practice before work, or go out for morning smoke but bring a yo-yo to play with instead of their cigarettes. The group will help each other come up with many useful options for their success. In the case study, which you can find written in the comments below, we discover that Joe is what experts call a help-rejecting complainer. Classic characteristics of the help-rejecting complainer, or HRC, are appearing in desperate need of help, requesting help, and then rejecting any help offered. HRCs seem to take pride in the fact that their problems are unsolvable and present them as insurmountable. They also show little regard for the feelings of the other group members, as they are competitors for the leader's attention and the award for the worst problem. HRCs are generally not aware of their lack of empathy for others. Experts agree on how to approach clients like Joe. Do not try to rescue them by offering help or advice. Do not show encouragement or optimism. Additionally, do not let them see you express frustration. Instead, use irony. Validate their perception of how hopeless the situation is, and take their suffering seriously. To move forward with choosing an effective intervention, we are missing important information in this case study, and that is what cultural factors are influencing the interpersonal group dynamics. If Joe were also a member of a minority group, would this influence the effectiveness of CBT interventions? Although CBT began in an era where cultural differences received little attention, CBT has always been about a strong therapeutic alliance built on understanding the situation from the perspective of the client's worldview. With this aim, the CBT leader may want to start by having Joe examine his perceived role in the group. This type of self-reflection and discussion would benefit everyone in the group. So for one intervention, each member can bring in their answers to the following questions for discussion the next week. What role do I play in the group? What behaviors are associated with this role? What is acceptable to say, do, think, feel in this role? What is unacceptable? What are the positive consequences of this role? What are the negative consequences? And is this a role I want to keep playing? Cognitive behavioral therapy has a proven history of interventions that are successful with groups of many kinds and stands as one of the most empirically validated methods.